Hello, everyone. My name is Krista Klee, and I'm honored to present today on behalf of the Mental Health Association in New Jersey, or MHANJ. Our mission is to empower individuals and communities to address mental health challenges through awareness, support, and accessible resources. Today, we are going to explore critical topics about mental health and crisis services, including the innovative 988 Suicide and Crisis Lifeline, local resources available in New Jersey, and how organizations like MHANJ work tirelessly to break barriers to care. Let's dive in. Before we get started, I want to start by giving you an overview of the topics we'll be discussing today. First, we'll look at some suicide statistics and review the national and state-specific data to understand the scope of the issue. Then we'll discuss what MHANJ is and take a look at our organization's mission, history, and services. Then we'll provide an introduction to 988, the National Crisis Hotline, and how it supports mental health and suicide prevention. Then we'll provide an overview of 211, of this critical service that connects individuals to essential health and human resources. We'll then discuss with you all how MHANJ can help you and provide a detailed explanation of our programs and services. Finally, we'll provide additional resources within the state of New Jersey, highlighting tools and services available statewide to support mental health. By the end of this presentation, I hope you will feel more informed and equipped to support mental health initiatives in your personal and professional lives. Let's begin with some national statistics on suicide. Over 49,000 people died by suicide in 2022. This is equivalent to one death every 11 minutes. Many adults think about suicide or attempt suicide, with 13.2 million individuals who have seriously thought about suicide. 3.8 million have made a plan for suicide, and 1.6 million have attempted suicide. In 2022, we saw troubling numbers among adolescents ages 12 to 17, with 13.4 million seriously thinking about suicide, 1.7 million making a plan, and 953,000 attempting suicide. These figures are from CDC and SAMHSA and represent the growing mental health crisis among our youth. They highlight the need for accessible mental health resources and preventative measures. Suicide doesn't discriminate. It affects people across all demographics, but certain populations like adolescents and veterans are especially vulnerable. In New Jersey, 779 individuals died by suicide in 2022. While our state has the lowest suicide rate in the country at 7.7 deaths per 100,000 people, every loss is one too many. Suicide is the 16th leading cause of death in New Jersey. Veterans in New Jersey experience a suicide rate significantly lower than the national average, but approximately 53 veterans still lost their lives to suicide in 2021. Firearms account for 28% of suicide deaths, emphasizing the need for safe storage practices and intervention strategies. This data underscores the importance of local resources like 988 and community-based outreach to provide support before it's too late. So, how can MHANJ help?
Mental illness is not just mental illness, it's how that impacts your entire life.
Mental illness is not something to be ashamed of or to hide.
Thank you for calling New Jersey Mental Health Care. How may I help?
So we want to welcome our consumers. They are welcome. It is a safe space.
I started out as a participant needing services.
I didn't know at the time that I was struggling with PTSD.
I had been in a position where I barely could get out of a chair.
The way
way the Mental Health Association of New Jersey helped my daughter and I was fantastic.
I was welcomed immediately with open arms.
MHA&J has given me a new career at age 60.
We have really been able to be one of the leaders, and being a leader in developing a mental health system that is finally dealing with the issues of bringing mental health out of the shadows and into the public eye.
MHA means to me everything. It gave me hope when I didn't want to live anymore. I'm a better person professionally, personally, and in every way because I have MHA&J in my life.
You know, when you're in a crisis, hope is the most important thing that you can have.
MHA&J is not just a service. We are a movement.
It's a movement.
We are a movement.
The Mental Health Association in New Jersey, or MHA&J, has a rich history of improving the lives of people with mental illness and substance use disorders. MHA&J is a statewide nonprofit organization whose mission is to strive for children and adults to achieve victory over mental illness and substance use disorders through advocacy, education, training, and services. As the association marks 80 years of service, there is too much to celebrate. MHA&J breaks down stigma and other barriers that prevent people from seeking treatment. It builds a strong base of support and network of services for people coping with behavioral health issues and their family members. Our mission at MHA&J is to strive for people to achieve victory over mental illness and substance use disorders through advocacy, education, training, and services. The Mental Health Association in New Jersey has been serving the community for over 80 years, and our mission is to help individuals and families achieve victory over mental illness and substance use disorders through advocacy, fighting for policies that improve mental health care and access and reducing stigma, education, providing trainings and information to empower communities, and services, offering direct support for individuals in need. At MHA&J, we create a world where mental health challenges are met with compassion, not judgment, and where everyone has access to the care they deserve. Now, let's begin to talk about what 988 is.
Suicide does not see race, does not see ethnicity. It happens in every single race, ethnic population that exists. It is increasing, and we need to come together to actually make a difference.
The greatest impact would be just having a heart for people, just knowing who you're talking to, getting to know that person, and basically not trying to solve their problem, but trying to get them to see that it's not as bad as they think it is.
In 2005, the National Suicide Prevention Lifeline number was initiated. It was the idea of a man who actually lost his wife to suicide after she was dealing with postpartum depression. And it was his vision that people would not have to search for the local number in their community to call. 988 is built on that same foundation.
So now the big thing that we all have to remember, like when we're providing services to folks in crisis, is that crisis is completely self-defined. If you're wondering if you should call, you should probably call.
So when a person calls 988, they're connected to a crisis counselor. And that crisis counselor is trained and is able to provide support.
A caller can expect to discuss alternatives to suicide, talk about coping skills, talk about resources, and ways to move forward beyond the call.
When you call on behalf of somebody else, what we do is we take every call like a crisis. So we ask questions about who they're concerned about, but we're also at the same time providing emotional support to the third-party caller as well.
So there are a number of misconceptions about crisis chat and text. The conversations, they're not scripted. There are things that we might need to assess for. There might be steps we need to cover, but the conversation itself has the potential to be just as authentic, just as human between two people as any other medium for communication.
When people are having one of the worst days of their life, they can call us, they can chat, they can text. And when they come out on the other side, they're feeling better.
Life is hard. Being a human is hard. And we all go through things and struggle. And if in my job I can provide one person with a safe space to talk and get the support they need, then that's a great job for me that day. So.
There is a lot of people out there that are struggling with suicidal thoughts and that are struggling with suicidal behavior, that are struggling with hopelessness and depression and anxiety. It is normal. And you don't have to feel ashamed for having those experiences, and there is help available.
(988) is a transformative step forward in crisis intervention. This 3-digit hotline, launched in 2022, offers 24/7 access to trained crisis counselors for suicide prevention, mental health crises, and substance use emergencies. In New Jersey, we have 4 centers responding to 988 calls, texts, and chats. This service also supports family members and friends worried about loved ones. By making mental health support as simple as dialing 988, we are reducing barriers to seek help. 988 is a transformative step forward in crisis intervention. This 3-digit hotline, launched in 2022, offers 24/7 access to trained crisis counselors for suicide prevention, mental health crises, and substance use emergencies. When you dial or text 988, you will be connected to the 988 Suicide and Crisis Lifeline, which is available 24 hours a day, every day of the year. You can also chat with 988 at 988lifeline.org/chat. People can dial 988 if they are worried about a loved one who is in crisis and may need support. All U.S. states and territories transitioned from the National Suicide Prevention Lifeline to 988 on July 16th of 2022. In New Jersey, we have 4 centers responding to 988 calls, texts, and chats. This service also supports family members and friends worried about loved ones. By making mental health support as simple as dialing 988, we are reducing barriers to seeking help. In addition to 988, there are specialized hotlines tailored to specific populations, including veterans, LGBTQIA+ youth and young adults, American Sign Language, Spanish lines, and the lines are also translated in over 200 languages. Now, let's take a look on how 988 has benefited the state of New Jersey. First, let's look at the volume of routed calls. Over the course of the year, the number of calls nearly doubled, increasing from 4,566 in May of 2023 to 8,385 in May of 2024. At the same time, the number of calls answered in-state rose from 3,865 to 6,141. As call volumes grew, there was an increased reliance on backup systems. The number of calls routed to backup systems rose dramatically, from just 195 in May of 2023 to 1,325 in May of 2024. Similarly, the flow out to backup rate climbed from 4.3% to 15.8%, showing that more calls required additional support as local systems reach capacity. Now let's focus on that response time. Despite rising call volumes, the average speed to answered remained consistent at around 28 seconds for most of the year, improving slightly to 25 seconds in May of 2024. This indicated a strong commitment to ensuring timely responses, even as demand increased. In summary, we are noticing the demand for the 988 call lines within New Jersey has doubled in 1 year, and despite rising numbers, the stable speed to answer demonstrates the system's resilience. When reaching out to 988, who will be the person to respond? Mobile crisis services already exist in the state of New Jersey, can be accessed by individuals in crisis, including mobile screening, mobile response and stabilization services, and crisis assessment and response and enhancement services. Mobile crisis outreach teams, or MCORTs, provide in-person support without involving law enforcement when it's safe to do so. These two-person teams consist of mental health professionals and peers, offering a compassionate and community-centered approach to crisis resolution. Stabilization services already exist in New Jersey and can be accessed by individuals or someone concerned for a person in crisis, such as designated screening centers, early intervention and support services, crisis residential service programs, and certified community behavioral health clinics. The Mental Health Association in New Jersey's call centers serve as a hub for support and resources for individuals and family members regarding mental illnesses and substance use conditions. MHA-NJ's call centers include a leader in New Jersey's 988 Suicide and Crisis Lifeline, New Jersey Mental Health Cares for emotional support, information, and referrals, our Peer Recovery Warm Line, New Jersey Connect for recovery for family members concerned about a loved one, New Jersey Disaster and Mental Health Helpline, and the New Jersey Self-Help Clearinghouse for support group resources. These are other call lines within the state of New Jersey, including the New Jersey Disaster Mental Health Helpline, the New Jersey Self-Help Clearinghouse, Cop to Cop, which is a 24/7 confidential peer support for New Jersey law enforcement officers and their families, NJ Vet to Vet, that is a 24/7 support to New Jersey National Guard members, active military personnel, veterans, their families, and caregivers statewide. Second Floor, which is a 24/7 365 confidential and anonymous helpline for New Jersey's youth and young adults. 1844 REACH NJ, which is a 24/7 central call line for New Jersey residents who are looking for help for a substance use disorder, and 211, which we'll dive into in a little bit. Now, let's discuss 211.
Life. It can get on top of you quickly, can't it? Missed bills, housing troubles, employment issues. It can be overwhelming, but with 211, it only takes one step to get connected to the help you need. You have the power, and the specialists at 211 can help, whether you know exactly what you're looking for or have no idea where to start. 211 specialists are trained to help you overcome seemingly impossible challenges. However complex they are, they're knowledgeable, empathetic, and have a deep understanding of available local resources. Whether 211 can provide help directly or connect you to the right next step, 211 is always available to help. So get in touch today.
"211 is another vital resource. This helpline connects New Jersey residents to services that address basic needs such as housing and utility assistance, food, mental health and substance use support, disaster services, and more. Its mission is to ensure all New Jerseyans have the resources to live healthy, safe, and fulfilling lives. Whether someone is in crisis or needs guidance on community services, 211 is there to help. How can MHA&J help you? MHA&J offers numerous programs to support mental health recovery and crisis intervention, including supporting individuals in recovery through our Consumer Connections program, supporting families through MHA&J's intensive family support services in Union and Atlantic counties, and supporting community wellness through MHA&J's wellness centers, Esperanza Self-Help Center in Union County, the ICE Wellness Center in Atlantic County, and Journey to Wellness in Ocean County. Additionally, the Mental Health Association in New Jersey provides outreach support to reduce stigma and provide education to our communities. We support education and training in mental health through our Mental Health Association players, our mental health first aid programs, and question, persuade, and refer suicide prevention trainings. The Mental Health Association in New Jersey additionally supports workforce development through their Career Connection Employment Resource Institute that provides training and advocacy surrounding the importance of education and employment within the recovery process of mental health and substance use disorders. MHA&J further supports our youth through providing suicide prevention training to youth-serving organizations, focusing on youths of color and youth who identify as part of the LGBTQIA+ community. The Mental Health Association in New Jersey continuously provides support to counties such as Atlantic, Ocean, Hudson, and Union, providing direct services to support and educate individuals with mental health challenges and co-occurring disorders and their families. Listed here are additional programs that MHA&J offers to our communities. We also collaborate with other organizations to expand our reach and impact, ensuring everyone in need has a pathway to care. To learn more about 988, check out samhsa.gov/findhelp/988 and newjersey.gov/human-services/DMHAS/initiatives/988 for more local information. If you are interested in learning more about branding for 988, please visit the SAMHSA website as well. New Jersey is home to a wealth of mental health resources, including designated screening centers for psychiatric emergencies, crisis residential programs, and certified community behavioral health clinics offering comprehensive care. We encourage you to explore these resources, whether for yourself, a loved one, or someone in your community. Together, we can build a stronger support system. This infographic provides information about examples of which line to call. It provides examples for specific situations for 988, specific situations for 911, and examples for 211 as well. This additional infographic is another resource that expresses what line is best to reach out to for support, whether that is 988, 911, or 211. Beyond crisis services, New Jersey provides additional support such as toolkits for suicide prevention, support guides for families and professionals, LGBTQIA+ affirming healthcare resources, and statewide initiatives like Talk Saves Lives to promote suicide awareness. These resources empower individuals and communities to address mental health challenges proactively. Thank you for taking the time to learn about these critical topics. Mental health is a community effort, and every one of us has a role to play in supporting those around us. Thank you.